The dust and heat of Forward Operating Base Shank rose through the Afghan afternoon air as medical personnel moved between treatment stations with the controlled urgency that characterized frontline medical facilities in active combat zones, where every decision carried life or death consequences for wounded warriors who depended on sophisticated trauma care delivered under conditions that would challenge the most experienced civilian emergency departments. Hospital Corpsman Second Class Rachel Martinez checked inventory levels in the surgical supply depot, her movements reflecting the systematic precision that distinguished combat medics who understood that proper equipment management could determine survival rates during mass casualty events when traditional medical protocols collapsed under the reality of battlefield conditions. The forward surgical team's trauma bay buzzed with constant activity as helicopters delivered wounded personnel from patrol operations and reconnaissance missions throughout the volatile Paktika province, where Taliban forces utilized increasingly sophisticated improvised explosive devices and coordinated ambush tactics that created complex trauma patterns requiring advanced medical intervention and innovative treatment methodologies. But when Captain David Morrison noticed her methodical approach to equipment organization and the careful attention she paid to specialized trauma supplies that exceeded standard nursing requirements, he dismissed her preparations as typical support personnel anxiety rather than recognizing the strategic medical planning that characterized personnel with advanced combat medical training and specialized tactical healthcare experience. His casual comment about nurses who overthink routine procedures reflected institutional assumptions about medical support roles that would be shattered when combat reality demanded capabilities that exceeded conventional medical training and revealed specialized competencies that had been strategically concealed within routine assignment structures. From which combat medical facility around the world are you following this frontline healthcare story today? If you appreciate narratives that explore advanced combat medicine and the specialized medical capabilities within tactical healthcare databases, consider subscribing for more content that reveals the exceptional medical personnel who operate with concealed expertise within combat medical environments. Forward Operating Base Shank occupied 4,200 acres of strategically positioned territory within Afghanistan's dangerous Paktika province. Its combat medical facilities and tactical healthcare centers representing the most sophisticated battlefield medical environment, supporting American military operations through integrated trauma systems and advanced combat medical protocols that enabled treatment of complex battlefield injuries under conditions that exceeded civilian medical capabilities. The installation served as the primary medical coordination hub for tactical healthcare operations, combining advanced surgical technology, specialized trauma specialists, and innovative medical protocols that provided unprecedented survival rates for military personnel operating in high-threat environments where conventional medical approaches could not address the complexity of modern battlefield trauma. Located within multiple defensive perimeters, the base had been constructed with specialized medical systems and trauma isolation capabilities designed to maintain medical effectiveness even during enemy attacks that targeted medical facilities and personnel. The base medical architecture incorporated decades of advancement in combat medicine and tactical healthcare methodology, including underground surgical processing centers, trauma protection systems, and automated medical algorithms that could provide advanced life support for dozens of critically wounded personnel simultaneously without compromising treatment effectiveness when combat requirements demanded immediate medical intervention under fire. Advanced medical systems analyzed trauma data from hundreds of casualties simultaneously, creating comprehensive injury profiles that tracked individual treatment responses while distinguishing between conventional battlefield injuries and complex trauma patterns that indicated enemy weapons development or tactical evolution requiring modified medical approaches and enhanced treatment protocols. Hospital Corpsman Second Class Rachel Martinez descended from the tactical medical station carrying routine trauma equipment inventories and medical protocol documentation, her security clearance providing access to medical areas that few personnel were authorized to enter during standard combat deployments. Though her current assignment to routine medical support seemed inconsistent with the extensive medical evaluation and specialized combat healthcare screening required for her clearance level and tactical medical background. The screening process for her current position had required 30 months of federal investigation that examined every aspect of her medical history and tactical healthcare competencies. Though investigators had encountered classified files that remained sealed at classification levels exceeding their authorization to review or discuss with conventional medical personnel. At 30 years old, she possessed specialized training from the Naval Medical Research Command's Advanced Combat Medicine program, having completed classified coursework in tactical trauma management, advanced battlefield surgery, and experimental combat medical integration before her assignment to conventional medical support following mission requirements that demanded complete capability concealment and operational invisibility within routine combat medical environments. Her official service record listed standard hospital corpsman specialization and conventional assignment history. Though these official designations concealed advanced medical expertise and tactical healthcare experience that had been classified following mission requirements and strategic decisions that eliminated programs deemed too sophisticated for standard military medical documentation and oversight protocols. Her educational background included instruction at medical institutions whose existence was compartmentalized beyond standard military medical oversight, where defense contractors and medical scientists developed methodologies that pushed the boundaries of human medical performance and tactical healthcare enhancement through advanced training protocols that exceeded conventional medical school capabilities. The programs she had completed involved theoretical trauma integration, advanced combat medical psychology, and experimental human medical interface systems that prepared personnel for medical scenarios that conventional military training could not address adequately or provide sufficient trauma preparation. Her instructors had included battlefield surgeons and tactical medical specialists whose experience encompassed decades of classified research into military applications of advanced medical capabilities and strategic trauma management technologies. The decision to accept assignment to conventional medical support rather than specialized tactical medical operations had been influenced by operational requirements and mission parameters that demanded her advanced medical capabilities remain available for activation on operations that required her specific trauma expertise and tactical medical knowledge, while maintaining complete operational invisibility within routine combat medical environments. Her presence within conventional military medical units provided medical security and trauma oversight, while her advanced medical background remained available for deployment on operations that required her specialized capabilities and tactical medical experience. Captain David Morrison supervised the afternoon medical briefing with authority gained through 16 years of military medical service and conventional education in combat medical management. His experience encompassing standard battlefield medicine and operational medical coordination that maintained American medical effectiveness within combat environments through traditional treatment protocols and established medical systems. His background included medical command assignments throughout conventional combat operations and liaison duties with medical organizations that coordinated standard battlefield medical activities and basic trauma management protocols. His combat medical badge and multiple medical commendations reflected competent performance in tactical medical command and routine combat medical coordination assignments that supported American medical interests within established battlefield medical frameworks. The captain's military medical career had followed conventional pathways from domestic medical operations to combat medical coordination, including standard assignments with medical organizations and combat commands that managed routine battlefield medical operations and basic trauma management activities that remained within traditional military medical boundaries and conventional medical frameworks. His progression from tactical domestic medical command to strategic combat medical coordination had been driven by institutional requirements for experienced medical officers who could manage standard combat medical activities and maintain American medical leadership within established battlefield medical structures. Around the combat medical briefing table sat representatives from Army Medical Command, Special Operations Medical Support, regional medical allies, and various tactical medical contractors, each contributing standard expertise to battlefield medical coordination and trauma management procedures that maintain medical effectiveness against conventional enemy capabilities and standard battlefield medical challenges. The assembled group represented decades of collective experience in combat medical operations, trauma relations, and medical coordination that supported battlefield medical effectiveness against traditional enemy forces and established trauma methodologies. Major Lisa Thompson, the trauma coordination officer responsible for combat medical communication and battlefield medical protocol management, possessed 18 years of experience in standard combat medical systems and held security clearances that provided access to routine intelligence regarding medical capabilities and trauma management methodologies that supported combat medical operational effectiveness. Her medical background included conventional training in battlefield medicine, basic trauma coordination, and standard medical evaluation procedures that enabled management of routine combat medical communication and coordination of appropriate medical responses and protocol compliance. Major Thompson's expertise encompassed conventional coordination between theoretical battlefield medicine and practical medical requirements, translating standard medical protocols into functional coordination systems that maintain medical effectiveness while ensuring readiness for conventional threats that remained within established medical capabilities and trauma frameworks. Her role required routine evaluation of medical reports, trauma assessments, and medical capability estimates to ensure adequate medical preparations for standard battlefield threats and established medical challenges. The medical coordination team under Thompson's management represented conventionally selected medical personnel recruited from standard medical contractors and military medical institutions, each bringing routine medical knowledge to the basic challenge of maintaining medical effectiveness against established enemy capabilities while supporting standard medical advantages that preserved American medical leadership within conventional battlefield medical frameworks. Their work followed established medical protocols, and their coordination decisions supported routine medical communication capabilities and standard response procedures that protected medical interests and maintained operational medical effectiveness. Lieutenant Commander Sarah Chun, the tactical medical officer responsible for combat medical communication and trauma coordination management, possessed extensive experience in standard combat medical operations and trauma management that enabled coordination and management of routine battlefield medical communication through conventional monitoring networks and basic trauma analysis procedures that remained within standard military medical capabilities. Her understanding of medical technology encompassed conventional trauma management systems and established medical technologies that operated within traditional boundaries of current medical understanding and provided capabilities that met standard combat medical equipment and procedural requirements. The medical commander's background included conventional training in battlefield medicine, standard trauma processing, and established coordination methodologies that enabled management of routine trauma management and combat medical communication that medical forces employed through conventional screening systems and standard operational procedures. Her responsibility for trauma coordination required routine technological maintenance and conventional strategic thinking that managed standard battlefield medical cooperation while maintaining coordination effectiveness for established combat medical threats and conventional trauma challenges. Captain, overnight intelligence indicates routine enemy medical targeting activities with standard battlefield capabilities that remain within our current threat assessment models and established medical parameters, Major Thompson reported, her voice carrying professional precision that characterized standard battlefield medical evaluation and conventional assessment procedures. Medical intelligence sources indicate enemy utilization of conventional medical targeting systems with basic anti-medical capabilities that operate within our existing medical protocols and standard trauma management measures, with technical details available through routine intelligence channels and conventional medical assessment procedures. Her assessment reflected standard evolution of medical targeting threats that characterized conventional medical coordination, where enemy forces utilized established anti-medical technologies and conventional tactics designed to challenge basic combat medical systems through standard vulnerabilities that could be addressed through routine medical adjustments and established response procedures. The intelligence indicated conventional advancement that required standard medical measures and routine protocol updates to maintain medical effectiveness and trauma management throughout combat medical installations and battlefield medical facilities. The current threat assessment represented routine intelligence analysis that had identified standard patterns indicating conventional enemy research into basic medical targeting systems and established trauma management countermeasures that operated within normal combat medical capabilities. Intelligence sources had reported routine development activities and standard testing programs that indicated conventional preparation for medical targeting capabilities that remained within established combat medical planning assumptions and standard medical parameters. Major, we've maintained our trauma coordination sensitivity and implemented standard medical verification procedures designed to manage conventional medical targeting activities and establish trauma management technologies that enemy forces employ through routine operational methods, Lieutenant Commander Chen explained. Her report reflecting systematic approach to trauma adaptation that balanced medical coordination capabilities with operational limitations of current battlefield medical cooperation and established trauma systems. Our current capabilities provide adequate protection against conventional enemy medical targeting activities and standard trauma challenges, maintaining effectiveness through established battlefield medical cooperation and routine trauma coordination throughout combat medical facilities. Her analysis addressed fundamental requirements for standard battlefield medical coordination, where conventional advancement supported routine trauma management, while enemy forces utilized established countermeasures that operated within existing combat medical advantages and standard trauma frameworks. The balance between current capabilities and conventional threats required routine maintenance and standard planning that managed established trauma management through conventional protocols and established battlefield medical frameworks. The coordination measures implemented by Chen's trauma team represented standard battlefield medical cooperation technology that incorporated conventional lessons learned from established battlefield medical operations and routine trauma management experience throughout combat military operations. Standard trauma processing, routine medical analysis, and conventional coordination systems provided capabilities that maintain medical coordination accuracy while supporting operational efficiency for established combat medical operations and routine battlefield medical management. While enemy forces continued utilizing conventional trauma management technologies that operated within American medical capabilities and established trauma management measures. Lieutenant Commander Chun, what specific capabilities do our current medical systems provide for managing the conventional trauma threats described in routine intelligence assessments and standard battlefield medical reports? Captain Morrison inquired, his question reflecting command responsibility for understanding trauma limitations and ensuring adequate coordination for American battlefield medical operations and combat medical installations throughout conventional operational environments. The question addressed standard challenges facing medical planners in conventional military medical cooperation, where routine advancement supported standard trauma coordination that operated within current battlefield medical capabilities and required conventional decisions about resource allocation and trauma management priorities that affected routine combat medical personnel. The assessment of current capabilities versus conventional threats was standard procedure for determining medical coordination adequacy and planning requirements for established battlefield medical cooperation and trauma coordination measures. Martinez quietly moved through the medical areas conducting routine trauma supply management. Her movements deliberately professional and systematic to avoid attracting attention, while she processed the psychological impact of hearing battlefield medical coordination discussions that connected her current assignment with conventional combat medical programs that utilized standard medical technologies within established combat medical capabilities and routine battlefield medical cooperation protocols. Her specialized training enabled recognition of battlefield medical discussions and trauma assessments that conventional personnel interpreted correctly through standard procedures and established understanding due to their routine medical background and conventional operational experience. Her background in advanced medical research provided unique perspective on trauma limitations and battlefield medical capabilities that informed her understanding of medical coordination assessments and battlefield medical planning. Though her classified medical history remained known only to specialized personnel who recognized her as exceptionally capable trauma specialist with advanced battlefield medical expertise and attention to detail that exceeded typical combat medical personnel performance standards. Her specialized knowledge enabled recognition of systematic advantages that conventional medical coordination procedures utilized effectively, providing insights that enhanced overall battlefield medical effectiveness and trauma management throughout combat medical installations. The trauma supply activities that Martinez conducted served primary purposes of routine battlefield medical coordination, allowing her to support trauma systems and maintain established medical coordination through conventional recognition techniques learned during standard combat medical programs and basic trauma analysis training. Her specialized knowledge enabled recognition of medical coordination advantages that conventional battlefield medical procedures utilized effectively, providing support that enhanced overall battlefield medical effectiveness and trauma coordination measures throughout the installation. The medical facility represented months of construction and engineering designed to provide standard battlefield medical monitoring and conventional trauma coordination while protecting personnel from routine electromagnetic effects and standard enemy medical coordination attempts that operated within established operational parameters. Conventional shielding, standard communication systems, and routine medical equipment created coordination advantages that maintained trauma effectiveness under normal operational conditions and conventional medical coordination attempts that remained within established threat assessment parameters. The engineering specifications that guided medical facility construction incorporated conventional lessons learned from established conflicts and routine advances in battlefield medical architecture developed by combat medical engineers and trauma specialists throughout standard battlefield medical cooperation programs. Each system component had been carefully designed to provide standard monitoring capabilities and conventional operational flexibility that supported established battlefield medical coordination while maintaining efficiency for routine operations and standard emergency response procedures that protected American battlefield medical cooperation and coordination effectiveness. Corpsman Martinez continue standard trauma supply procedures but remain alert for any routine medical behavior or conventional operational activities that might indicate standard medical coordination requirements or established battlefield medical protocols. Lieutenant Commander Chen instructed. Her guidance reflecting conventional security protocols while acknowledging medical background that Martinez brought to trauma evaluation and facility medical coordination activities throughout her standard assignment. Her instructions contained routine recognition of Martinez's medical expertise and analytical capabilities that exceeded standard trauma supply training, though the acknowledgement remained appropriate for language that preserved operational security regarding her advanced background and specialized knowledge that other personnel were authorized to access through conventional procedures. The guidance reflected institutional awareness that her capabilities supported her current assignment while maintaining established operational security protocols. The battlefield medical briefing continued for 40 minutes, with various specialists contributing trauma assessments and battlefield medical recommendations based on current intelligence and medical coordination analysis throughout combat military operations. The assembled group represented standard combat medical expertise available for battlefield medical cooperation and trauma planning, with conventional backgrounds that supported understanding of established medical technologies and battlefield medical capabilities that existed within standard programs and routine combat medical development. The complexity of standard battlefield medical coordination in conventional military medical cooperation required synthesis of intelligence from multiple sources, including trauma monitoring, battlefield medical intelligence, medical coordination analysis, and routine modeling that enabled management of conventional enemy battlefield medical capabilities before they exceeded established threats against American trauma management and battlefield medical coordination. The analytical precision required for effective battlefield medical planning operated within capabilities of combat medical specialists and supported collaborative effort from experts with established battlefield medical backgrounds and standard security clearances throughout combat medical organizations. Martinez positioned herself near the trauma monitoring equipment while maintaining routine supply duties that provided support for observing battlefield medical discussions and medical coordination considerations that indicated standard trauma coordination and established battlefield medical limitations throughout the facility. Her advanced medical background enabled recognition of medical coordination capabilities and battlefield medical parameters that conventional personnel interpreted correctly through established procedures due to their standard exposure to routine battlefield medical methodologies. The coordination activities that Martinez conducted automatically incorporated standard analytical techniques learned during conventional combat medical programs that emphasized battlefield medical innovation and established strategic thinking within routine military planning and trauma coordination. Her ability to evaluate trauma systems enabled identification of established improvements and conventional advantages that standard battlefield medical thinking utilized effectively, providing valuable support for battlefield medical cooperation enhancement. The emergency alert became critical approximately 50 minutes into the medical coordination session, when the facility's communication system crackled with urgent reports of a coordinated enemy ambush against a Special Operations Reconnaissance Patrol operating in the dangerous mountain terrain surrounding the base, requiring immediate medical evacuation and advanced trauma response that would test every aspect of the facility's medical capabilities and personnel training under direct enemy fire. The initial casualty reports indicated multiple wounded personnel with complex trauma patterns that exceeded standard battlefield medical protocols, including a critically wounded Navy SEAL with compound fractures and internal injuries who required immediate surgical intervention that could only be provided at the Forward Operating Base medical facility. The helicopter evacuation would land the medical team directly in the combat zone under active enemy fire to retrieve wounded personnel and provide emergency medical treatment under conditions that exceeded standard medical safety protocols. We have multiple casualties inbound from Grid Reference 74 Alpha, announced the medical evacuation coordinator through facility communication systems. Primary casualty is special operations personnel with critical multiple trauma requiring immediate surgical intervention. Secondary casualties include patrol members with various battlefield injuries requiring advanced trauma management. Helicopter landing zone is under intermittent enemy fire with limited security coverage. The casualty report indicated battlefield medical challenges that exceeded routine trauma management and demanded immediate deployment of advanced medical capabilities under combat conditions that threatened medical personnel and challenged standard medical evacuation protocols. The wounded special operations personnel represented critical medical priorities that justified enhanced risk and demanded exceptional medical response capabilities. Captain Morrison immediately began coordinating standard medical evacuation procedures while expressing institutional concerns about medical personnel safety under combat conditions. We'll deploy standard medical evacuation team with routine trauma support capabilities. Corpsman Martinez can provide basic medical support from secured positions while experienced combat medical personnel handle advanced trauma management under fire. His medical response reflected conventional battlefield medical thinking that prioritized personnel safety through established protocols while maintaining standard medical effectiveness within accepted risk parameters. The captain's approach demonstrated institutional medical training that emphasized graduated response and conventional medical role assignments that protected support personnel from excessive combat exposure. But as the medical evacuation helicopter approached the landing zone with rotors thundering through enemy gunfire and wounded personnel requiring immediate advanced trauma intervention that exceeded standard medical protocols, Martinez moved toward the medical evacuation equipment with decisive professional competence that transformed from routine supply support to advanced combat medical leadership under extreme battlefield conditions. Her transition to medical evacuation readiness represented calculated response to battlefield medical emergency that demanded immediate deployment of capabilities that had been concealed under routine assignment and conventional medical security protocols. The critical medical situation justified revelation of advanced medical abilities that exceeded standard combat medical capabilities while maintaining operational security regarding the full extent of her specialized training and tactical medical background. The helicopter touched down amid sporadic gunfire as enemy forces continued targeting the medical evacuation site, creating dangerous conditions that demanded advanced tactical medical capabilities and exceptional physical performance from medical personnel who would operate under direct enemy fire while providing life-saving medical treatment to critically wounded special operations personnel. Martinez approached the aircraft with movements that demonstrated advanced tactical medical training as she immediately assessed the critically wounded SEAL who required emergency medical stabilization and immediate evacuation to surgical facilities. The wounded operator had sustained multiple battlefield injuries, including compound leg fractures, internal bleeding, and potential spinal trauma that demanded advanced medical intervention under combat conditions that exceeded standard medical safety protocols. Critical patient assessment complete, Martinez announced with professional medical authority while implementing advanced trauma protocols that exceeded standard battlefield medical training. Patient requires immediate spinal immobilization, advanced airway management, and hemorrhage control while maintaining tactical mobility under enemy fire. Implementing advanced combat medical protocols for tactical evacuation under hostile conditions. Her medical assessment demonstrated advanced trauma, evaluation capabilities, and tactical medical decision-making that indicated specialized medical education and combat medical training that exceeded standard hospital corpsman preparation. The sophistication of her medical terminology and precision of her trauma evaluation suggested advanced institutional medical preparation for tactical medical operations under extreme battlefield conditions. Without waiting for conventional medical authorization, Martinez deployed advanced trauma management equipment while coordinating with helicopter medical personnel. Patient requires immediate tactical medical evacuation with advanced life support capabilities. I'll provide direct medical support and tactical mobility assistance while maintaining advanced medical intervention throughout evacuation process under hostile fire conditions. Her medical coordination demonstrated complete transformation from routine medical support to advanced tactical medical leadership that commanded immediate attention from combat medical personnel and special operations evacuation team members. The authority of her medical direction and precision of her tactical medical coordination indicated specialized education that exceeded standard military medical training and suggested advanced institutional preparation for tactical medical leadership roles. As enemy gunfire intensified around the medical evacuation site, the wounded SEAL lost consciousness from blood loss and trauma complications that demanded immediate advanced medical intervention and tactical evacuation to surgical facilities. Standard medical evacuation protocols called for multiple personnel and specialized medical evacuation equipment that was not immediately available under current combat conditions and enemy targeting of medical personnel. Martinez made immediate tactical medical decision that demonstrated exceptional physical capabilities and advanced combat medical training. She positioned the wounded SEAL across her shoulders in a tactical carry position that distributed his weight while maintaining spinal stabilization and continued advanced medical intervention throughout the evacuation process under direct enemy fire. Tactical medical evacuation in progress, Martinez announced while carrying the critically wounded special operations personnel toward the medical evacuation aircraft. Patient stabilized with advanced airway management and hemorrhage control while maintaining tactical mobility under hostile fire. Estimated evacuation time 30 seconds to medical aircraft with continued advanced medical support throughout transport. Her tactical medical evacuation demonstrated extraordinary physical strength and advanced medical competency that enabled her to carry a critically wounded adult male while maintaining sophisticated medical intervention under combat conditions that exceeded standard medical safety protocols. The combination of exceptional physical performance and advanced medical capabilities indicated specialized training that prepared personnel for tactical medical operations under extreme battlefield conditions. The tactical evacuation proceeded with Martinez providing continuous advanced medical care while maintaining tactical mobility under enemy fire, her movements demonstrating combat medical training that enabled effective medical intervention under conditions that challenged conventional medical protocols and personnel safety guidelines. Her medical performance under extreme combat stress indicated institutional preparation that exceeded standard battlefield medical training and suggested specialized tactical medical education. Throughout the evacuation process, Martinez maintained advanced medical monitoring while coordinating with helicopter medical personnel, patient vital signs stabilizing under advanced medical intervention. Continued advanced airway management and hemorrhage control while maintaining tactical evacuation mobility. Patient preparation complete for immediate surgical intervention upon arrival at medical facility. Her medical coordination throughout the tactical evacuation demonstrated exceptional multitasking capabilities and advanced medical training that enabled simultaneous tactical movement, advanced medical intervention, and medical coordination under extreme combat conditions. The sophistication of her medical management under battlefield stress indicated specialized preparation that exceeded conventional combat medical training and suggested advanced tactical medical institutional background. The successful tactical medical evacuation resulted in the critically wounded SEAL receiving immediate surgical intervention that saved his life, while Martinez's exceptional performance under combat conditions revealed advanced tactical medical capabilities that exceeded institutional expectations and demonstrated specialized training that had been concealed under routine medical assignment protocols. Captain Morrison approached Martinez with professional medical recognition that reflected institutional appreciation for exceptional tactical medical capabilities. Corpsman Martinez, your tactical medical performance exceeded all expectations and demonstrated advanced combat medical capabilities that saved a critical patient under extreme battlefield conditions. Can you explain your preparation for advanced tactical medical operations that enabled exceptional performance under hostile fire? His question demonstrated institutional recognition that Martinez's capabilities extended far beyond routine medical support duties and indicated potential for expanded responsibilities within tactical medical coordination and advanced combat medical operations throughout battlefield medical facilities. The precision of her tactical medical intervention suggested qualifications that exceeded standard military medical training and indicated specialized preparation for tactical medical leadership roles. Sir, I completed advanced tactical medical training through the Naval Medical Research Command's Experimental Combat Medicine Program before assignment to routine medical support duties, Martinez explained carefully, providing information that contextualized her exceptional performance while maintaining operational security regarding classified medical programs and specialized training that exceeded standard military medical acquisition. My preparation included advanced trauma management, tactical medical psychology, and experimental combat medical interface systems that prepare personnel for complex tactical medical operational scenarios. Her explanation provided sufficient context for her exceptional capabilities while maintaining appropriate operational security regarding classified training programs and advanced medical technologies that informed her tactical medical coordination and combat medical analysis methodologies. The acknowledgement of Naval Medical Research Command background explained her exceptional performance while preserving security regarding specific programs and medical developments that exceeded standard institutional parameters. The revelation of Martinez's advanced tactical medical training provided explanation for her exceptional combat medical capabilities while raising institutional appreciation for specialized medical programs that prepared personnel for complex tactical medical operations that exceeded standard military medical requirements. Her presence within routine medical support duties suggested strategic assignment decisions that maintained access to exceptional medical capabilities while providing operational security for advanced tactical medical programs. Captain Morrison made immediate command decision that reflected institutional recognition of exceptional medical capabilities and operational requirements that demanded specialized tactical medical expertise and combat medical analysis competencies. Corpsman Martinez, you are immediately reassigned to Senior Tactical Medical Analyst with expanded combat medical coordination responsibilities. Major Thompson, integrate Martinez into advanced medical operations with appropriate security clearances and expanded authority for tactical medical intervention and combat medical analysis. The reassignment represented institutional acknowledgement that Martinez's exceptional capabilities were critical for enhanced combat medical coordination effectiveness and tactical medical cooperation that supported battlefield medical operations and advanced medical coordination requirements. Her demonstrated competence in tactical medical operations aligned with institutional needs that demanded sophisticated analytical capabilities and advanced combat medical expertise throughout combat medical installations and battlefield medical programs. The immediate nature of her reassignment reflected military medical efficiency in recognizing and utilizing exceptional talent when operational. Situations revealed capabilities that exceeded institutional expectations and strategic medical requirements. Captain Morrison's decision demonstrated medical leadership flexibility that supported rapid adaptation to discovered capabilities and institutional recognition of exceptional talent within existing medical personnel resources. Major Thompson provided Martinez with advanced medical coordination equipment that reflected institutional recognition of her exceptional background and combat medical analysis capabilities. Welcome to Advanced Tactical Medical Coordination, Corpsman Martinez. Your combat medical expertise and tactical medical analysis represents exactly the capabilities we require for enhanced battlefield medical operations and tactical medical cooperation throughout our combat medical environment. Her welcome represented beginning of professional relationships based on demonstrated exceptional capability rather than rank or institutional assumptions about medical competency within military medical organizations. The recognition of Martinez's advanced tactical medical background promised opportunities to contribute meaningfully to critical battlefield medical operations that enhanced combat medical effectiveness and maintained tactical medical cooperation throughout battlefield medical installations. The professional recognition implicit in Thompson's welcome reflected fundamental transformation in institutional appreciation for tactical medical diversity and combat medical competency within military medical organizations. Martinez's progression from routine medical support duties to advanced tactical medical coordination demonstrated potential for exceptional talent to transform institutional medical capabilities when operational situations revealed specialized competencies and strategic medical requirements. The tactical medical coordination that Martinez implemented resulted in successful combat medical response to battlefield medical emergencies and provided enhanced tactical medical cooperation that improved long-term operational medical effectiveness throughout combat medical installations. Her medical analysis enabled appropriate tactical medical coordination and combat medical assessment that enhanced strategic medical success while maintaining operational security for advanced tactical medical programs and battlefield medical cooperation methodologies. Her contributions included coordinating tactical medical operations, implementing combat medical analysis protocols, and providing battlefield medical assessment that enabled successful combat medical operations under complex tactical medical conditions and challenging battlefield medical environments. Each contribution demonstrated value of advanced tactical medical research applied to practical battlefield medical situations that enhanced operational medical effectiveness and tactical medical cooperation throughout combat medical installations. The tactical medical coordination protocols that Martinez developed became standard reference for advanced battlefield medical operations throughout combat medical installations, demonstrating importance of maintaining institutional expertise in tactical medical capabilities and recognizing personnel with exceptional combat medical backgrounds regardless of initial assignment or apparent medical qualifications. 12 months after her tactical medical demonstration, Hospital Corpsman Martinez received promotion and assignment as Senior Tactical Medical Analyst covering multiple combat medical installations and advanced battlefield medical operations. Her advancement reflected institutional recognition that exceptional tactical medical capabilities and combat medical expertise required appropriate recognition and opportunities for expanded responsibility throughout battlefield medical operations. Her progression from routine medical support to advanced tactical medical coordination demonstrated military medical capacity for recognizing exceptional talent when circumstances revealed capabilities that exceeded institutional expectations and strategic medical requirements demanded specialized expertise. The transformation reflected institutional learning about importance of recognizing tactical medical diversity and combat medical competency within military medical personnel, regardless of initial assignment or conventional medical background. Today, Petty Officer Martinez leads the Advanced Tactical Medical Division, overseeing battlefield medical operations and combat medical analysis that supports medical installations throughout multiple theaters of operation. Her team of tactical medical specialists continues advancing battlefield medical coordination capabilities and combat medical cooperation methodologies that enhance medical effectiveness against sophisticated enemy medical targeting and tactical medical challenges. Her leadership represents culmination of career that experienced initial misconception and evolved into directing critical tactical medical operations that support the most sensitive battlefield medical coordination missions throughout combat medical installations. The trajectory demonstrated how exceptional tactical medical talent and combat medical expertise could transform both individual careers and institutional capabilities for advanced battlefield medical cooperation throughout tactical medical operations. The organization she directs has become model for integrating advanced tactical medical expertise with operational battlefield medical requirements, attracting exceptional talent from medical institutions and combat medical analysis programs throughout military medical organizations. Her success has inspired recognition programs throughout combat medical commands that seek to identify and utilize personnel with exceptional tactical medical capabilities and advanced combat medical expertise. The Corpsman they had dismissed as just a nurse had become the medical foundation for advanced tactical medical operations, demonstrating that exceptional combat medical capabilities often exist within personnel whose specialized backgrounds remain hidden by institutional assumptions and conventional medical bias. Sometimes the most critical medical capabilities come from individuals whose advanced tactical medical knowledge transcends traditional boundaries through dedicated service, and institutional medical effectiveness depends on recognizing exceptional talent regardless of assignment, background, or initial medical role throughout military medical organizations.